pleural effusion in the lungs. When suspected, how do you diagnose it? We have to do a chest X-ray. Now, on a chest X-ray, we can roughly quantify the amount of effusion that is present. And on an ultrasound, we can actually take a good volume measurement of the fluid. So how does the patient present and how can this be managed? So patients generally present with cough, chest pain and fever. These are the most common symptoms. The procedure for chest fluid drainage is either diagnostic or therapeutic. The diagnostic procedures are for taking samples to evaluate further what is the cause of this effusion. Is it infective, or is it inflammatory, or is it due to third space collections? The next is for third space collections in patients with cardiac failure, renal failure, or hepatic disease, or hyperproteinemia. Now, how do you do a diagnostic tab? Basically, we have to enter with a needle through the intercostal space and take a sample, which is about 50 ml, and then this is taken in a sterile container and then sent to the lab for all tests like cytology, pleural fluid ADA levels, pleural fluid culture sensitivity, etc. The other indication is therapeutic, where we want to decompress the chest and take out a lot of fluid, which is about a maximum of 1.5 liters, or as much as is collected and gives the patient symptom relief. How do you assess post-procedure? A simple X-ray is done post-procedure and we see the re-expansion of the lung along with reduction of the volume of the fluid, pleural fluid. Now this procedure of pleural fluid tapping or thoracocentesis can be done by a radiologist by using ultrasound guidance, or it can be done in a blind method. Radiologists doing this procedure have seen to have higher success rates than the blind procedures done commonly in ICUs and in hospital settings without guidance. The blind procedures which have failed, 90% of those are successful on ultrasound guided methods. 10% had some other cause or they were non-aspirable effusions. Some important things that we need to remember while doing this procedure are rule out coagulopathy, and the patient should not have only one working lung. The third is the patient should not have echinococcus disease. Now, post-procedure, much care is not required if the procedure was simple and done under ultrasound guidance. Therefore, this is a very easy procedure and can be done in an OPD sitting or in the ultrasound room easily. So if you have any questions now, you can just ask us on our comments page. Please like, share and subscribe to our YouTube channel. Thank you.